Hi, I am Dr. Virendra Shorain, Associate Director, Division of Peripheral Vascular and Endovascular Surgery at Medanta, the Medicity Hospital, Gurgaon. Varicocele embolization. It's the latest, most advanced method to treat varicocele. Varicocele is a disease in males in which the veins of the scrotum gets dilated, and the treatment to decrease this dilatation in a most advanced way is called as varicocele embolization. Varicocele embolization has many indications. So when do we do varicocele embolization? Whenever a male patient comes with pain, heaviness, discomfort in his scrotum, it becomes an indication to treat varicocele. Number two, whenever a patient is married and his sperm counts or the semen analysis is poor, secondary to varicocele, diagnosed on ultrasound, he needs a varicocele embolization. Varicocele as a disease has many causes why it happens, but actually there are many hypotheses, like it is more common on left side because our anatomy is so the left sided vein drains into left renal vein which has an acute angle. There can be a compression of the vein through the artery. It is related also to your profession. A thin person with less fat, chronic constipation, these are all causes of varicocele. So, does varicocele always affect sperm? I would say there are different grades of varicocele. Varicocele from grade 1 to grade 5, usually grade 3, 4 and 5 starts affecting sperm count, and more the advanced stage of varicocele, more worse is your semen analysis, and it decreases the quantity as well as quality of your sperms. If someone ignores varicocele, what are the ill effects? The patient who is male will have continuous on and off dragging pain, his quality of life will decrease, and maybe if he is married, he may be infertile due to poor sperm count, and there could be an issue with child or the family, I would say. So, is varicocele once treated remains permanent by embolization? I would say yes. Varicocele embolization is the most advanced way and non-surgical way without any incision to treat varicocele. Once it's done, it's permanent. The chances of recurrence are very minimal, and if properly done, it's almost zero. Once varicocele embolization is done, the patient is free to go home within an hour on the day of the procedure. He can do all his activities from day 2. We usually encourage our patient to do all normal activities from next day. However, very strenuous and heavy activities or heavy or aggressive sports are to be played after 2 weeks. So, for the person who is infertile secondary to varicocele, after varicocele embolization, if the varicocele is high grade, the data supports yes, there is improvement in the sperm quality and the quantity. However, the results are not 100% all the time, but it is, I would say, somewhere between 70 to 80%, and it takes little time, 3 to 6 months. The question remains, can varicocele be prevented by some methods? I would say yes. If you have a very long standing job, if you are doing a very aggressive sports activity, if you are a singer who sings on a high note, you can wear like a V-shape underwear or a scrotal support. That definitely helps to decrease the pressure in the scrotum. Sirsasana is one of the way in which helps to relieve the pressure. So, there are various maneuvers which can definitely help in decreasing or preventing the varicocele to advance. Thank you.